Hi everyone, Kay Bruckner here today with Dr. Tom Phelan, author and creator of 123 Magic, as well as the Manager Mom Epidemic. And we don't typically talk about it, but it's relevant today. He is also the author of All About ADHD. And today, that's exactly what we're talking about, all about ADHD. So Dr. Phelan, welcome.
Good morning, Kay.
How are you today?
I'm doing pretty good.
Good. Glad to hear it. So we are going to talk about ADHD, and let's start by talking about what it is. Can you define for us what is ADHD?
Yeah, ADHD is it's a developmental condition that often appears as the kids are growing up. And the core symptom these days they talk about mostly is kids having difficulty paying attention. But the other symptoms that go along with that are what we used to call hyperactivity, extreme activity level. Child looks like they're driven by a motor and so on. And also impulsivity, which is acting without thinking, talking without thinking, motor mouth, they just keep going and going and going. There are some kids that have inattentive and they're fairly sedate. They're not as wired. But these kids, they sort of come after you, and they can be very difficult, especially for moms.
Absolutely. Especially if I would imagine at the younger ages that motor mouth can. I've seen some memes that are, if I had a penny for every time my kid said my name today, I'd have $10,000. And it's only 9 a.m. So,
Right.
so as far as ADHD, where does it come from? How would one get it?
Well, it's not contagious, but it is hereditary. It's one of the strongest hereditary links that we have, I think, in psychology and psychiatry. So some people say, well, it's 80% hereditary, whatever that means. But it means if you have a parent who's ADHD, there's about a 50% chance they're going to have a child that has ADHD. And if you have a child who has ADHD, there's a 30% chance that their brother or sister will also have it. So it's a very strong link. So, it's not caused by bad parenting, but hereditary is pretty powerful here.
Which kind of brings me to a side question. I feel like we know so much more about ADHD now than we did when, the people who are parents today with kids who have ADHD, than when they were children. How likely is it that if there is a child who has ADHD, that perhaps their parent is undiagnosed ADHD?
It's still pretty likely. The way that a lot of adults find out that they do have the ADHD is when they come into our office to do an evaluation for their child. Because we have to do what they call a developmental history for the kids, but we also do a brief developmental history for the parents. And that's often very revealing, not only to me, the psychologist, but to the parents themselves. One dad had his 5-year-old in to see me, and we were doing the evaluation, and the dad told me that he, the father, had been tied to his chair in kindergarten by the teacher um, to, to keep him from running around and causing trouble. So that's one point for ADHD. It doesn't mean the child is or the dad was, but it certainly heads in that direction.
And certainly a different time when it comes to classroom management, which, if you're a teacher having trouble with your classroom, we do have 123 Magic in the classroom, and I promise that tying the kids to the chair is not one of the recommended courses
Not
of
in
action
there,
in
right?
there. So you mentioned having a dad and a 5-year-old in to talk about diagnosing for ADHD. At what age might parents start noticing symptoms of ADHD? You talk about being driven by a motor or talking a lot, but some of that seems like pretty normal toddler behavior. At what point would parents maybe start noticing that it's beyond a normal developmental energy?
Yeah, and you can look at it in two ways. One of the biggest points is going to be like the early elementary school years. So if they're first or second grade, now you have to sit still and pay attention all day to things that are often very boring to children with ADHD. So both their inattentiveness and their hyperactivity or impulsivity are going to often be disruptive in the classroom. But there are kids who, when they're still preschoolers, You're not going to get a preschooler on inattentiveness because, as you were saying, they're all kind of inattentive. They don't pay attention that well. But what you can see is the excessive motor activity or sometimes excessive aggression. And sadly, one of the criteria we often see in the preschoolers is that they've been kicked out of one or two preschools, and because of aggression or hyperactivity and that kind of thing. So the diagnosis, you can actually make a diagnosis, they tell us, in some ages 3.5 to 4, which sounds pretty early, but it's not going to be on inattention. It's going to be more on behavior.
Got it. So if a parent thinks that they have a child who may have ADHD, what are the first steps that they should take?
Well, you want to you might take a look at the All About Attention Deficit Disorder, learn something about it. Now you have to be careful if you go onto the internet. A lot of the stuff on the internet is garbage. So go on to chadd.org, chadd.org, and look around and learn something about it. The next step would be to talk to maybe your pediatrician. Say, who do you have? Do you have somebody you could refer me to who does evaluations for ADHD? You could talk to the school in normal times. Now it's not quite so normal. So you may be looking for somebody who is outside of the school. And psychologists and mental health professionals are now more adept at doing virtual evaluations where you don't actually have to go in the office. Some still have that you come in the office. Uh, but the first step is to find somebody who you think might be able to evaluate and treat ADHD. And then you want to have some questions based on your research when you were looking at the book or you're looking at CHAD. Do you treat ADHD? How do you evaluate it? What's your philosophy of treatment? How do you deal with medication? All those kinds of things. And you want to ask a few questions on the phone of the person that you might be seeing. Don't be too deferential or passive. You want to be fairly assertive about it.
Absolutely. That's one of the things that we have talked about recently is when it comes to a mental health provider or a healthcare provider at all, a lot of people I think tend to, like you said, be extremely deferential and feel like they're the less powerful one in that situation. But
Right.
a mental health provider and a healthcare provider, those are service professions, right? They are there to help you, and the only way that they can, or the best way that they can help you, is if you really advocate for yourself and what you need.
I think so, and I've told my patients a lot, and this is very hard for them to think about, but a mental health professional or your pediatrician is a doctor who is a servant whom you pay to do what you want. And some people say, "Oh, no, no, I can't." They're a god who tells me what to do. And no, not quite.
Yeah, they have a lot of knowledge, absolutely. But you're the one who knows yourself and knows your kid. So Dr. Phelan mentioned Chad, and he doesn't frequently mention this when we talk about this, but Chad is an organization that supports parents who have children with ADHD, and Dr. Phelan is actually a Chad Hall of Fame nominee. So I see the face that he just made there. He doesn't like it when I say nice things about him, um, but he has a very long history, and has done a lot of work with kids with ADHD, which really leads into my next question. Does 1, 2, 3 magic work for kids who have ADHD?
Oh, yes, it does. If you're in a private practice like I am, outpatient, I'm a clinical psychologist, about 40% of your first referrals are going to be ADHD at least. Now, there are often other conditions that go along with it, but you're going to see a lot of it. And 1, 2, 3 Magic really came out of my private practice and my work with pediatricians. So as you can imagine, there's a large cohort of ADHD kids that are the basis for 1, 2, 3 Magic. It's not totally for ADHD, but it's for average kids as well. But yeah, there are a lot of ADHD kids, and so if you can control an ADHD kid, you can control anybody was our motto. So we had to learn, try and figure out some ways to deal with these kids, and so it's very helpful with them.